the microanatomy of pituitary gland. Eta pituitary ta ekhon amra now thyroid gland, parathyroid gland, now tongue, salivary glands, all the salivary glands. When you do pharynx, larynx, you will be seeing the tonsils, the epiglottis, cornea, retina. On today, the thyroid, and we'll show you the glands. তোমাদের দেখা হয়ে গেছে? হ্যাঁ, তাহলে we'll what to do আজকে লাংটা দেখিয়ে দিই, ট্রেকিয়াটা দেখিয়ে দিই, হ্যাঁ, in the gross plus in the histology. ঠিক আছে? গ্ল্যান্ডের স্লাইড গুলো দেখেছো তোমরা? সব দেখে নিয়েছো? এবার now chapter outline. See, nasal cavities, pharynx, larynx, epiglottis, trachea, bronchi, lungs. Now we'll see today trachea and the lungs and portion of the bronchus. Now, because you will be having thorax now, next, after superior or inferior extremity. কি হবে? যাই হোক, আমি এখন একটা আউটলাইন বলে দিচ্ছি। যদি thorax or breast dissection have come, naturally next class you are having a breast dissection. Naturally, thorax will be opened because I'll have a lecture on intercostal spaces and the diaphragm. Actually, thorax, if it is there, it is there. And now, respiratory system is primarily meant for oxygenation of blood, involves transport of gases to the lung. Respiratory system consists of conducting portion and the respiratory portion. The conducting portion transfers the air but does not participate in the gaseous exchange. It consists of nasal cavities, pharynx, larynx, trachea, and bronchi up to the respiratory bronchiole. Respiratory portion is involved in gaseous exchange. It consists of respiratory bronchioles, alveolar ducts, alveolar sacs, and alveoli. Okay. Now you will see the lung. I'll show you a specimen, the lung. And now the consistency of the lung tissue, you feel it, যা করবে feel করবে। WhatsApp chat করলে, but you will have to wish to meet that person, to touch that person. So you have to ঘাঁটতে হবে, দেখতে হবে, দেখবে, ঘাঁটবে, হাত দেবে। এটা হচ্ছে ডাক্তারির মানে মূল কথা। একটা পেশেন্টের বাচ্চা এলো, ঠিক আছে, তাকে তুমি তোমার গ্রিপে আনতে হবে তো। যেমন একটা Tuesday morning, early morning, actually 2 days or 3 days, I go to micro forest, my own micro forest. I go in the mornings and come spend 2 hours there. It is a garden with, you are invited, open invitation. You have to get a permission from me. ওখানে 300-350 আম গাছ আছে, 150 থেকে 200 নারকোল গাছ আছে, নানা রকম গাছ আছে, and your Siberian birds come. Okay, so I spent some time there. Now, so I was just going into the car. In the morning, there's a train that reaches my place from Pakur at around 7:30, and with a baby, with a girl of 3 years old. She got an electric burn, and she came. So I told them, my parents, that আমি একটু বাগান থেকে আসছি, আমার স্টাফেরা এখনো ঢোকেনি. But if it had been an emergency, I would have cancelled and then I would have attended. Now, that girl, what I did, কি হয়েছিল রে? তারপরে আমি তাকে, শোন, তোকে আমি চকলেট দেবো, ললিপপ খাও. Then I went to my garden. I came. after 2 hours. Then when the dressing was to be started, I have my granddaughter. She gives all these Cadbury's gifts. She's not addicted to it. Addicted to this, na hole hobe na, she'll start crying and throw tantrums. No, she doesn't do that. So what I did, I took her permission. যে আমি তো 3টে ললিপপ নেবো আর একটা ছোট্ট ডেয়ারি মিল্ক হ্যাঁ now what I did, I just before the dressing, my sister and your মিঠু দা was there. I just told him, এই চকলেটটা তোকে বলেছিলাম না আমি দেবো, I gave the sweets. ঠিক আছে তাহলে চল বাবু চল। Then she what একটা ফিয়ার কাজ করছে। কিন্তু what I want to say is that, what I want to explain, you have to মানে একটা সেকেন্ডের ব্যাপার, 1 মিনিটের ব্যাপার একাত্ম বোধ করা। Similarly, with anatomy, you have to be, don't think it's a dead body, don't think it is a this thing, but it speaks thousands, millions of words, but you feel it. At least you won't be a neurosurgeon, but you won't be opening the brain, but you might be. One of you might become a neurosurgeon. So you have to know the feeling of the tissue. It is formalized. Kintu at a cirrhotic liver and your and normal liver, non-cirrhotic, the two tissue structures are different. The lung, which is a formalized lung, you will feel it, spongy and this thing, air spaces are there. Now the trachea, then the total bronchioles and this thing, that architecture you will see in histology. And good textbooks, any good textbook, atlas, anything, and it is now the conditioning of air. During the passage of air in the respiratory tract, the air undergoes conditioning that involves warming, moistening, filtration. The respiratory tract shows goblet cells secrete mucus. This mucus covers the inner aspect of the respiratory passage and traps the particulate matter to keep the passage moist. Now that it respiration, you will just see. Now, in the pathological part, when you see the anatomy, you only cough high. Are you coughing? And something is coming out, sputum. It is yellow color or watery. You suddenly catch cold, and then there is a watery discharge from your nose, and your cough, whatever is sputum, is just watery. Mucus is there. Now, if it is infected, it can be yellowish. If you have a chronic bronchitis or any infection of the lung or bronchiectasis, means there's a cavity there. And sometimes you cough, blood comes out. But even that blood comes out when you are having tuberculosis, if you are having hemoptysis, that's known as hemoptysis. Hemoptysis. So you have to know the what is the, you have to picturize, you have to see. দেখলে হ্যাঁ এটা তো একটা রুটিন, যখন তুমি you go and see patients, you will be having, but you have to have the knowledge. Okay. Nasal cavities এখন না, head neck যখন হবে, yeah. Now see the nasal cavities, the pharynx, oropharynx, larynx, trachea, bronchus, bronchioles and alveolar ducts. Alveolar are not shown over here. It's not shown here. But the main thing, trachea is there. You will get a slide of trachea, cartilage, muscles and all this. So that you will see. Okay. This is the interior of the larynx. Epiglottis. Now, the question can come. Write a short note on histology of trachea. The trachea is a cartilaginous tube that acts as an air passage from larynx to lungs. Length about 10 centimeters, diameter about 2.5 centimeters outer, and 1.5 to 2 centimeters diameter. The trachea divides into main primary bronchi. The lumen of trachea is non-collapsible, remains open due to cartilage. Viva, this is the unique feature of trachea, presence of C-shaped hyaline cartilage. Now it's a C-shaped hyaline cartilage. The C-shaped hyaline cartilage. Okay. Now, histology of trachea. Now, the wall of the trachea shows mucosa, submucosa, cartilage muscular layer, and adventitia. You will see in the slide. So, this is the larynx, and then it goes there, bifurcates, and আসো. এই সকালে ক্লাস, এই সকালে কি মর্নিং ওয়াক করতে গেছিলিস না মেলা গ্রাউন্ড ভিজিট করতে গেছিলিস? ক্লাস করিসনি কেন? হ্যাঁ, শোনো, এক্সকিউজেস যা দেবে দেবে, নিজের বিবেকের কাছে প্রশ্ন করবে। Question yourself if I am doing the correct thing or not. No, you are not answerable to any person, but you have to answer to yourself. এটা লাইফের মোটো it should be. You তারপরে কি, ঠিক আছে চলো, টুডে কুল ডাউন। আর হাঁটছিস কি, তোর পায়ে লেগেছে, চোট লেগেছে কি খেলতে গিয়ে? কি খেলা? না, কাবাডি খেল, তাহলেই তো ঠিক হবে। ক্রিকেট খেলে কি হবে? ফুটবল খেলছিস? ভাই শোনো, we are speaking of the respiratory system and lung, trachea. These two histological slides will be shown to you. Histology of trachea. Now, what is the function of the trachea? You are breathing in. Now, you are reading the headlines are there in your newspaper. Delhi, so much mask and this thing, smoke and dust, everything. Now, you see, when you go to any city, but in Calcutta or Delhi, anything, after you're traveling, you're not having a mask or something like that. The trend became wearing a mask is from Corona. But usually then when you go home, you just take your handkerchief and you wipe, or tissue paper, you wipe and see black. And you just sneeze out and see in the white basin, it is blackish. Now, these things, how much nature can protect is that nature will always try to protect. Always it will try to protect. Now, see, the trachea is lined by ciliated pseudo-stratified columnar epithelium. You have the picture in your mind, the pseudo-stratified, like it's stratified, but it is like false. But the cells are there, and it's ciliated columnar epithelium. Cells of tracheal epithelium. Tracheal epithelium shows the following cells: ciliated columnar cells, mucus cells, brush cells, small granule cells, and basal cells. You just see the slide, and I mean the picture of the epithelium, and you see it has cilia. Just it's going on like this. You are breathing, but it's unconscious. You're unconsciously, they are doing their. You are not feeling that something is doing hawa khach. So how much it can filter, whatever the way the lung works in physiology, it will talk to you. Now, now histology of trachea. Basement membrane, thick basement membrane is the characteristic feature of trachea. HS basement membrane is present as a glassy or homogeneous eosinophilic pink layer. Lamina propria, it consists of loose connective tissue. The mains show diffuse lymphocytes and lymphatic follicles in the form of bronchus-associated lymphatic tissue. The lamina propria also contains numerous elastic fibers. Now, on HLA scene, it's difficult to distinguish demarcation between lamina propria and submucosa. If you need a special stain for this, don't bother which special stain and all. You just know HNE stain, and then you can put a note into it that this in HNE, you need special stains to see. Now, tracheal cartilage. Ashun. Now, tracheal cartilage and tracheal muscle. Trachea contains 16 to 20 shaped C-shaped hyaline cartilage rings. Identification, because the gap of the C-shaped cartilage is bridged fibroelastic tissue and trachealis muscle, smooth muscle. With advancing age, hyaline cartilage may be calcified. Hyaline cartilage, it consists of chondrocytes lying in the lacuna surrounding homogeneous matrix and perichondrium. Adventitia, it is a fibroelastic connective tissue layer that contains blood vessels and nerves. Yeah. Layers of the trachea. See, this is the mucosa, this is the submucosal layer, this is the cartilage muscle, adventitia, submucous gland, these are the glands. Okay, hyaline cartilage, trachealis muscle, this is the trachealis muscle. It is C-shaped. It is C-shaped. And this portion is muscle. Pseudo-stratified ciliated columnar epithelium. See the submucosal glands, this is the adventitia, hyaline cartilage, perichondrium, submucosa, and this is lamina propria, pseudo-stratified ciliated columnar, adipose tissue in the fat, trachealis muscle, this is the muscle fibers, you can see the individual muscle fibers with goblet cells. Now, this is the HNE stain. It is the mucosa. This is pseudo-stratified columnar epithelium, submucosa. Then this is the cartilage, hyaline cartilage. This is the adventitia to. Okay. ছবি দেখো আর এই দেখো এগুলো সব কার্টলেজ, ঠিক আছে? এইটা there will be a slide there. There will be a অভ্যাস করো চোখে জল পড়বে, নাকে জল পড়বে, ঠিক আছে? এবার কথা হচ্ছে যে নাও এই যে টিস্যুটা, এটার ফাংশনাল অ্যাসপেক্ট ব্লোজ, এটা হার্ড হয়ে আছে, বাট ইফ ইউ সি আ ফ্রেশ লাং, ইউ গো, মা বললো মাংস নিয়ে আয়, খাসির মাংস, তো ইউজ, ওরা দেখবে মেটের সঙ্গে লাং মিশিয়ে দেয়, নাও মিশিয়ে দেয়, দিস না ফুসফুস দিস না, হ্যাঁ, মেটে বলে চালিয়ে দেয়, ঠিক আছে? তো তুই অ্যানাটমিস্ট হয়ে, এই জানিস আমি তোর থেকে বেশি মানে মানুষ কেটেছি আমি, হ্যাঁ, তুই লাংটা নিবি, দিয়ে বলবি যে এটা তোর ফুসফুস, এটা তোর মেটে, it is not liver. So the consistency and the feeling of the tissue will give you the architecture of that specific tissue. বোঝানো গেল? বেশ। হ্যাঁ? কোটা? না, ঠিক আছে। এবার এটা দেখো, these are the markings of the after formalization, the ribs, marking of the ribs. এই যে এগুলো আছে না এরকম, এটা কিন্তু লিভিং কন্ডিশনে কিন্তু ইট ইজ নট লাইক দিস। এটাই ইসোফেগাস। এই যে দিস ইজ দি কার্টিলেজ। Thyroid cartilage. Thyroid cartilage. Your tracheal cartilage. And see, this is anterior. This is anterior. And posteriorly, it is resting on the vertebra, thoracic vertebra. Naturally, in this part, it is the muscles. The picture I showed you, the muscles are there. Take it. Now, তোমরা চলে যাও। 1, 2, 3, 4, 5, হ্যাঁ চলে যাও। ওর চলে যাও, স্লাইড গুলো লাগানো আছে, লাং অ্যান্ড ট্রেকিয়া। এই ওই এমনি করে দেখিস না, ওই টাচ অ্যান্ড পাস নয়, দাঁড়া, টাচ অ্যান্ড পাস নয়, দেখবি ভালো করে, কারণ এগুলো পরীক্ষায় আসবে। Now this is the lung, okay. Now this is the anterior aspect, the posterior aspect. এগুলো thorax-এ আবার রিভিশন হবে। আমি জাস্ট এটা বলতে চাইছি, now see it is so soft. Now you go to a meat shop, মা পাঠালো যে একটা খাসির মাংস নিয়ে আয়, স্কুটি চালিয়ে চলি সল্টলেক সেক্টর 2-তে চলে যাবে, ঠিক আছে? তো এবার তোকে গোঁজামিল দেবে, তুই বললি যে একটু লিভার, আমি একটু পয়সা দেবো, তুমি লিভার একটু বেশি করে দাও, তার ফাঁকে ফাঁকে লাং ভরে দেয় কেটে। এই কালারটাও তো পিঙ্কিশ থাকবে, আর ওটা মোর ডার্ক brown and this thing. Now you can see the difference between the non-formalized. I'm just giving an example because liver is a liver for goat or pig or cow, even human beings. Consistency wise, feel wise, it is like that. And then naturally, you see, it is soft. And what is the function of the lung? I told you. You breathe, that has to blow. And if there is any obstructive features or anything like that, any pathology, then it becomes a strain. That's why there's a dyspnea. Any pathology is there, if lower pneumonia or some this thing, when you read thorax, you see the pleuritic fluid, and in your radiology plate you will see that it's the fluid level, the costophrenic angle is in that angle the fluid is collecting. So that expansion of this thing is not, it is restricted. So this is lung. You will see ওরা যা দেখছে তারপরে তোরা ঢুকবি। See, now you see this is the trachea. Now this is the anterior portion, the larynx. Now in this trachea, see, it is a C-shaped cartilage. I showed you C-shaped cartilage, the muscle is there, trachealis muscle. Now the trachealis muscle is here. You C-shaped cartilage and trachealis muscle, that is trachea. and it is covered by pseudo-stratified epithelium. ঠিক আছে? এত দূর হয়েছে? You go to a meat shop, বলেছি বেশ। এবার এটাতে তোমার এই C-shaped cartilage. Now this is the posterior aspect, this is the anterior. বুঝে না গেল? তোমরা চলো ওখানে আস্তে আস্তে চলো। হ্যাঁ কোনটা? না ওটা তোমার এটা কম্পোজিট, এটা হচ্ছে pharynx, larynx, oral tongue. That will be taught when your head neck will be explained. And I'm just showing you a portion of the tracheas here. By the time you will do dissection, you will see, we will dissect out and we'll show you. Okay. Chalo, khata now. Khata. Now, see, I told you in the histology that the trachea is C-shaped. C-shaped trachea. Okay? Rings. You can feel it. Your own trachea will feel. Rings. And it is a very important to know the trachea because you have to do in emergency. If any person is gasping, then you do a tracheostomy, emergency tracheostomy. When trachea stomy, make a hole in the between the cartilage, you make a hole and put a pipe, oxygen. If you are in emergency, you have a big bore needle, blood, this thing, BT set needle. You put inside, in between two rings, you put in. The two rings are, the muscle is there. So you put in, and that tube, the thing you collected with the oxygen cylinder and transport to any thing. Say you are in your one clinic is there in say Salt Lake Sector 1. Now the hospital, nearest hospital is wherever the location. You do this thing with the permission of the patient. Oxygen cylinder. Otherwise, oxygen mask lagi patao. This can be this thing. By the time you are doing an emergency, it can to help to some extent. And tracheostomy, and ENT surgeon will come and then does tracheostomy. Or nowadays, the anesthetist will be called. You can do endotracheal. It goes within the tube during anesthesia, and the endotracheal tube has a balloon, so it doesn't come out, and it is like this tube, like in the your Foley's catheter, self-retaining Foley's catheter. The endotracheal tube has a small tube there like this. This thing. You once you pass it through the your the mouth, larynx, and goes into the your target is larynx and take your now what happens, you see with a laryngoscope, see the larynx and it's gone into the esophagus or your, so naturally this you put a air inside and this there's a balloon like, so that doesn't come out, and you connect the oxygen pipe here. Similarly, now you have to be very careful with the your handling. Now only see, this is the trachea. It's lined by pseudo-stratified ciliated column epithelium. You will see the slide there, and the cartilaginous rings, C-shaped cartilaginous rings, and you see that, and also there's lung alveoli and lung this thing. You go home, draw pictures, notes, not in the physiology, chemistry, biochemistry, you do anatomy. Or in the anatomy, you are drawing या हिस्टोलॉजी खाता. What I want to say, you make your hands free. Relax. I'm just showing you and telling you that the tissue consistency, the architecture, and what is the function of the lung, and what is the trachea, and it's the cartilage, C-shaped cartilage with this thing. You don't take notes anything. Histology দেখবে ওইখানে what a viewing you see. Now, see, this is the lung. This is the lung. Okay. This is the posterior end. This is the anterior end. It will be taught to you in your thorax. This is the undersurface that rests on the diaphragm. Okay. And these are the bronchioles, bronchus. This is you see a book. You see primary, tertiary bronchus, alveoli, and all this. It's like a branching, a branch with alveoli. Now, what I want to say is that the consistency, this is formalized. Your liver is also formalized. Your mom says, go to the meat shop. You go, oh, mutton hoga aaj. Now, with liver, when they chop, they are mixing lungs. It has a color of more or less একটু pinkish থাকে lungটা, কিন্তু ওটা গোজা মিল. But you want liver, liver fry with a peg of gin or vodka. So that you have to say, the ফুসফুস দিচ্ছিস, hey, you're giving lung, chalo chhada, isko liver do, hum paisa denge. Get it? Now that is the consistency of difference between a liver and this thing. But the feel, if I keep it like this, এই ধরো একটু এইরকমই ধরো, এইরকম করে করে দিলাম, এটাকে আমি বললাম, why this is not liver? তুই বললে যে না, this is lung. Why? তখন it has its different tracheal bronchus entering, the feel of the liver and feel of the, when you see the abdomen, the thorax আগে দেখে নিলে. Now, can you understand me? বাবু হাত তোলো, যদি না পারো বুঝবে, স্যার, I cannot understand you. Don't keep it in your, আমি কিছু বুঝলাম না, বাড়ি গিয়ে হোস্টেলে গিয়ে. So you have to this thing. Now this is the lung. The liver anatomy is different. Now what I wanted to say is that the trachea with bronchioles and this thing, primary, tertiary bronchus, and then it distributes. You see the book today, just at a gross features, just see the diagram or the atlas or download in your tab or laptop, and এটা নিয়ে গিয়ে একটু জাস্ট খেলার চলে, তার সঙ্গে তুমি একটা ভালো অরিজিৎ সিং এর গান লাগিয়ে দিলে or some music. You see view pictures. Seeing is believing. Until unless you see and go on, it's a ongoing process. Eta gelo tomar, and the thing, the tissue section there, you will see alveoli, the epithelial cells and everything. Now, this is the cartilage which I showed you earlier. It is the cartilage here, C-shaped cartilage. Now, this is the anterior portion. So you feel your cartilage. ওটা ল্যারিং, তারপরে ট্রেকিয়া ওইখানে you will feel the rings. Okay. Now, I was telling regarding the tracheostomy tube. Then you directly put how you do a tracheostomy, and that tube is put into the trachea. And the balloon is blown. During general anesthesia, it is you have to put a tracheostomy tube and connect to the nitrous oxide and oxygen. Get it? chalo. The lung, now this is soft, and now I was making the difference between a liver and a lung. Now the consistency, what I want to say, the gross anatomy you know, and the consistency you know, that will be reflected in the histology. Get it? Now what I want to say is that this is the lung with your the bronchus or primary, tertiary, and then bronchioles and the alveoli, and then now if you take a histology section, you will see it there. And another is that, see, trachea, C-shape it. This is the cartilage. You can feel it, cartilage, and this is the muscle, the C-shape it, and you can this thing. এখন histology দেখে নাও.